Hello and welcome to The Doctor is In. We hope that while you are staying safe at home, we can provide you with the medical advice that you need. I'm Dr. Freddie Gomez, and you're watching CNN Philippines. We hope that you get most out of your medical telemedicine appointment today. So please send in your questions and we will do our best to answer them. And as always, thank you for joining us. Since the start of the community quarantine last March, we've seen the effects of COVID-19 on our mental health in a very stressful time. And many of us are worried about getting sick. We're worried about our overall, and some of us are concerned about our jobs, our businesses, and there are many, many reasons. The coronavirus outbreak is triggering anxiety and fear. There are also some people who have existing mental health conditions, and that's even harder. So today, our focus will be on how we can cope. We are joined today by clinical psychologist Dr. Eppy Gochangco. Welcome to the show, Dr. Eppy.
Thank you, Dr. Gomez.
Now,
How are
the
you?
COVID-19 pandemic has affected many of us in different ways. How does an event like
Yes.
this affect the way we think?
Well, if you say the way they think, what I'm getting from what you're asking is how it does affect people, and usually what does affect is, especially right now with the COVID-19 virus, is that it affects the socialization of people, the need to have power and livelihood. When we talk about socialization, we talk about human beings as a natural need, which has a natural need to socialize. And when we talk about the need of power, people naturally have the need to control things around them, control themselves. And so when they feel that they are not able to control things, their anxiety level goes up. Um, this is when people start feeling uncomfortable or they feel discomfort. Um, there are other forms of feeling powerless without physical restriction, even if a person is not stopped from going anywhere. If the person feels he cannot go anywhere, like right now, where we have the GCQ, where people are more able to move around versus before when we had the ECQ, um, they still have the anxiety due to the feeling that they cannot do what they want. And when we talk about livelihood, this means our natural need to survive physically. Therefore, before when people started, during the past hundreds of years and thousands of years, people need to survive by eating, and therefore they have to either pick berries or fruits or hunt animals. But right now it's translated so many times that being an architect, doctor, IT expert,
Right,
media expert becomes their way of
right.
um, picking berries and fruits or hunting animals. It's translated that way.
Right.
So
But
because you
but
are
but
not
doctor,
able to act this out, yes, go ahead.
yes, Dr.
Sorry.
Epi, during this time, I'm sure a lot of people's, yes, the way they think, like what you said, is full of stress and anxiety. But many of us experience stress or anxiety during these times of uncertainty. Some people are more driven actually in the presence of stress, while others may not do
Yes.
so well. Do you think the ability to
Yes.
handle stress is purely dependent on one's personality, or are there other factors involved?
Yes, very much so. There are people who have positive views or perspective of things, and there are those who don't. And the ones who will get affected much are those people who have the negative perspectives of things. Yeah.
That's right. So now let's answer some of the social media questions that have been posted. We have one from
Yes.
Almi. Ang tanong ni Almi, are there manifestations of stress that are alarming? I guess what Almi
Uh,
might be trying to say is, are there manifestations of stress that are extreme? Some extreme manifestations of stress.
Yes, anxiety is a normal response. Actually, it's a helpful response. When you are anxious, what happens is you try to do something about the event that it makes you anxious. However, it becomes normal when the anxiety is becomes debilitating already. For example, you are not able to function well at work or in relationships.
All right. We have another question from Gerson. Ang tanong niya is, what's the difference?
Sorry, I didn't catch. Could,
Yes. The question was, what is the difference between anxiety and post-traumatic stress disorder?
okay. When we talk about anxiety, again, as I've said earlier, anxiety is a normal experience for everybody. So it's natural for us to feel anxiety when, say, for example, you lost someone or you lost your job or anything like having to say experience having to look for your ID which you need to get to work. The anxiety makes you do things in order to solve problems around you, the same way as all feelings and emotions that people experience has a reason. It makes you do things in order for you to be able to cope with life events. When we talk about post-traumatic disorder, in itself, you will see that this becomes a difference because it is a disorder, whereas an anxiety is not a disorder. An anxiety is as an experience that makes you do things or makes you experience something to make you do things. Now, when your anxiety level becomes really high, that's when it becomes a problem. And one of them is the post-traumatic disorder. And when you talk about post-traumatic disorder, is that it is triggered by something, an event that is really scary, or that's why it's called post-traumatic because it's traumatic. It's either you experienced it yourself or you witnessed it. Even if you were hiding behind a cabinet, for example, you would be able to still have trauma just by watching something happening. For example, a child who's inside um, a cabinet looking through a hole can see that another child is being
All right.
abused by an older person. The
Yes.
child inside
Dr.
the
Gochangco,
cabinet
we'll,
will have the same
we'll talk
symptoms
more
as the
about
child
we'll
who's.
talk more about different types of disorders. But right now, let's pause for a quick break. So after the break, we'll look into how important it is to have a support system, especially during these uncertain times. Stay tuned to The Doctor Is In. You're watching CNN Philippines. Hi, and welcome to The Doctor Is In. We hope that while you're staying safe at home, we can provide you with the medical advice that you need. I'm Dr. Freddie Gomez. Thinking about the future during these unprecedented times can be stressful. How do we cope? That is a question that we pose to a lot of people today. And we are joined by clinical psychologist Eppy Gochangco to help us sift through that question. So, one of the hardest things that can happen to any one of us is to lose a loved one. With quarantine restrictions, it's not easy to have that support system that one needs during this difficult time. But while it takes time to heal, there are some steps we can take to help with the loss and grief. So, my question is, how do we start or how do people start coping? Epi, what do you think?
Yes.
How should
Yeah.
people start coping whenever they're dealt with this kind of loss, especially in these
Well, yeah.
extraordinary times?
When people lose someone, what they go through is a grieving process, and there are 5 stages. One is denial and isolation. Therefore, the denial of the loss, and then they isolate themselves. These are ways of coping. The things that I'm saying. Now, the next is anger. The other is bargaining, and then we have depression. Then you have acceptance. Sometimes the order, it's not all the time that the order comes the same. It can be different for different people, and there are different experiences. For example, the one that Dr. David Kessler says, that shock can also be experience and guilt.
Okay, so but in difficult situations like these, how important is it in having a support system?
Very important. People always need others to survive emotionally, and therefore people have to be there in order to help someone who has lost others.
Yes, okay, so let's take a look at some of the social media questions that we have posted. The first one is from Precious, and she's asking, excuse me, does creating new routines help you to move on?
Yes, because what happens when you do a new routine is you sometimes the former routine is associated with something traumatic or something negative. And because it is associated, the person does not actually connect the two events, but actually sometimes one routine might be associated to a negative event. And if you do find another routine, it will actually bring you out from the negative experience. So it would be good, it would really be good to find other routine or other activities.
Okay, that's good to know. We have another question from Emong. Ang tanong ni Emong, when you are lonely and anxious, ano ang mga bagay o routine na dapat iwasan?
Um, uh, I don't know if this question comes from the COVID event or not, but when you say lonely and anxious, it might have something to do with relationships. The person might have problems from within, and which is now triggered by relationships with others. So the question, anong ang mga bagay o routines na dapat iwasan? Yung mga routine na dapat iwasan ay yung mga dating for example, kung laging dumadaan yung tao doon sa isang lugar na kasama yung isang tao na yun, for example, a particular restaurant, maybe it would be best to not to expose. But there's another way where you constantly expose yourself until the feeling goes away. So it's either you avoid or you flood yourself with the experience. So again, like the answer earlier, new routines would be good. It would be good because you learn something new, and it distracts or nadidistract ka doon sa dating o yung sa problema mo or the situation that makes you lonely.
Okay, very well. Thank you very much for joining us today, Eppy Gochangco, our clinical psychologist that has helped us answer so many questions today.
Thank you, Dr. Gomez.
And just ahead, we'll be showing you the efforts of online support groups in addressing mental health problems during this time. Stay tuned to CNN Philippines.
As we move to the next stage of easing restrictions, the reality is the COVID-19 pandemic is far from over. The coronavirus remains a serious public health risk, Good personal hygiene is our first line of defense. Wash your hands often with soap and water and for at least 20 seconds. Scrub all surfaces of the hands. If hand washing is not immediately available, use alcohol-based hand sanitizers. Wear a mask. The coronavirus is transmitted through direct contact with respiratory droplets of an infected person generated through sneezing or coughing. Cover your mouth and nose with a tissue or handkerchief when sneezing or coughing. Avoid touching your face. Maintain social distancing. Keep a safe distance of at least a meter from others whenever possible. Avoid crowds. Stay at home if you have any cold or flu-like symptoms and seek medical advice. We're in this together.
Hello and welcome to the Doctors In on CNN Philippines. I'm Dr. Freddie Gomez. The topic for today is the importance of a mental health support system during this time of COVID-19. Online support groups and social communities are an option for those people who need a little emotional support in order to get by. Joining us now is Ms. Maria Michelle Noscal, a psychologist from the Philippine Mental Health Association. Welcome to the show, Ms. M.
Hi, good afternoon, Doc Freddie. Good afternoon to all the viewers.
Ms. M, how does online counseling here in the Philippines work? What should people expect from this?
Actually, in terms of the online counseling, no, it's the same as the face-to-face. It's just that the difference is more of it's either voice call or phone call or online and chat, but the ethics is the same.
Okay, but so far, what have been the most common concerns that you've encountered from people that are pretty much related to this whole COVID-19 situation?
Yes, majority, Doc Freddie, is more of the uncertainty of what will happen, no, yung ating current situation. At as well as the family, yung health ng family and yung health nila, especially if they're going out for work. So basically, another one is overthinking. So nakaka-resulta nito yung problem with sleep. So those are generally the problem right now in terms of the pandemic.
Okay, so if someone who is watching this would like to talk about something with an online counselor, paano sila mag-uumpisa? How do they start?
Actually, Doc Freddy, there are list of online services, no? Makikita natin ito sa social media. But for PMHA, they just have to visit our page. Nakapag-chat sila doon. Basically, we have responders to attend to their needs. Tapos usually if they need self-help tips, we provide them that, psychological first aid as well. And at the same time, if they need referral para sa ating mga psychiatrists, we also do that. So they just have to use or maximize yung ating online technology for this.
Okay, very good. So let's take a look naman at yung mga tanong na pinost on the CNN Philippines Facebook page. We have one from Zandra. Tanong ni Zandra is online counseling open for 24 hours? How long does a consultation last?
All right. There are online services that provide 24/7. But at the same time, meron din po na 8 to 5. So depende dun sa kanilang mapipili na nagpa-provide ng online service. And then usually the online counseling session lasts from 1 hour to 1.5 hours.
Now, ang tanong ko, Miss M, is for example, meron nang nag-start ng online counseling, ano? May nag-avail ng service na ito, and meron nang na-assign na counselor sa kanila. And then, yung mga follow-ups ba nila is with the same counselor or iba't ibang counselor kada session?
In PMHA, same counselor, same psychologist po yung nag-handle sa ating mga clients.
Okay, so with regards to follow-ups naman na nakukuha naman sa kumbaga there is continuity naman ano with the counselors and the clients.
Yes, Doc. That's right. Kasi we have to assess ano yung progress nila. Time ano need.
Okay. Okay, sorry for that slight technical difficulty. We have another question from Furley. Ang tanong ni Furley, after the online counseling, can I also schedule a face-to-face appointment?
Yes. Once na bumalik na tayo, no, na we have the opportunity again to go back to office, we can continue the face-to-face session, of course, with precautionary measures.
Okay, so face-to-face appointment is possible naman if...
And we have another question from Boyet Dumagsang. Ang tanong ni Boyet, since this is online, how do you ensure confidentiality?
Oh, right. So in terms of the confidentiality, we of course treat them as private, yung privacy natin and confidentiality. And as much as possible, yung it's the same as in the office. We have that specific data for that, and they also have to sign a consent form for the data privacy. So we do not divulge that to anyone except to the professional or the mental health professional.
Okay. Yung ganitong klaseng online counseling, Miss M, may bayad ba ito? And if so, roughly what kind of figure or magkano ang ina-expect ng mga kliyenteng mag-a-avail nitong service?
Mm-hmm. Actually, Doc, there are institutions provide free services. In our case, we provide free service pag po affected with COVID, and at the same time, and their families as well, plus the OFW repatriates and frontliners. We provide that for them as free. In terms of other fees, no, depende kasi ito sa institution, Doc.
Yes, that is true. Depende rin sa institution, but that is an excellent service because you provide it free, especially those as much as possible for the frontliners as well. Definitely, sometimes nakakalimutan na mga frontliners then do need someone to talk to with regards to the amount of stress that they feel every day. Thank you very much, Ms. M. Noscal, for joining us today at least naliwanagan mo kami on some of the technologies available with regards to online counseling.
You're welcome, Doc.
And thank you also for the questions that all of you have sent in today. I hope we were able to help. So we'll see you again on Monday, 3:30 p.m. dito lang sa The Doctor is In on CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.
Amid the darkness, look on the bright side. Miss Universe 2018, our very own Catriona Gray, is a shining example of strength and positivity. Catriona is partnering with the health department to help stop the spread of COVID-19. In this campaign, she says knowledge is power. Catriona is also calling on everyone to be a COVID-19 warrior and not to be a worrier.
Please magdasal lang tayo, find what we can give. It doesn't have to be in a monetary value. It can be in an act of kindness or an act of service.
The world's biggest artists sang in harmony to pay tribute to frontline medical workers in the global battle against COVID-19. The special benefit concert, Build One World Together at Home, was streaming live all over the world on Sunday, April 19th. It was curated by Lady Gaga in support of the World Health Organization. Lady Gaga herself performed and raised $50 million. Elton John had a stirring rendition of I'm Still Standing, and the show closed with a stunning performance of The Prayer with Andrea Bocelli, Lady Gaga, Celine Dion, John Legend, and Lang Lang on the piano. I'm Ria Tanwat Cotrillo, CNN Philippines.